Okay, Dr. Castanet, coming to you again today, this time with a lumbar MRI scan. Um, I'll show you some slices of an MRI scan. This is a patient who's about 75 years old, a lady. I saw her about 20 years ago. She initially went to get some pain management injections at L45. They didn't help at the time. She came to me, I helped her. She's been doing reasonably well. Um, since I last saw her. She just recently started using a TENS unit and doing aquatic therapy for the first time yesterday. She also takes CBD now for her pain. She has pain in both buttocks, the anterior thighs, and both feet. Um, she's had this problem for some time, so it's not like she's been doing fine in the 15-year interim since I last saw her. And for some reason, she didn't think to call me. I've moved my office a couple of times since I last saw her, but I'm still generally in the same location. And then for some reason, she thought to call me and came back in, and I treated her once. I don't know how she has done yet from the one treatment, but her MRI scan does not look that bad. This was done recently, and she had a comparison done with a previous one. Apparently this slip down here, it's a mild anterolisthesis at L45, has developed since she had the last one done. I don't have the last one for comparison. The rest of the spine looks reasonably well. I don't see any significant disc herniations. Looks like an anterior disc herniation at L23, but posteriorly there's not much. Up here at the lower thoracic area, she does have some end plate deformity of this vertebra and this vertebra, but otherwise looks reasonably good. Let's go to the next slice. This is a cross-sectional image. Pretty large canal here. She does have a broad-based disc bulge throughout here, maybe an annular tear there, that white high signal on the right there. Could be some impingement here at the foramen on both sides, but the canal's fairly large and patent. Let's go to the next image. This is a T1 weighted image because the canal is dark colored, and you see again the slip L45, fairly modest. Pretty good disc height at L5S1, a little less so there, a little better there, a little less there and there. I don't know if that's the last one. Yeah, that's the last one I have of her. So we will see how she does. Again, reasonably good looking MRI scan. I don't think that the appearance of these images explains her symptoms. So I'm at a little bit of a loss with her. We'll see how she goes clinically. She got some other issues that could be confounding and contributing to her problem that I won't discuss here. But we will see how she does. In terms of the MRI scan, though, I explained to her, yeah, you have a little slip there. Now, maybe the slip looks worse when you're walking around because this is taken on a lumbar MRI table, lying supine, face up. There's not weight bearing of this region. Maybe it looks worse when she's standing, and maybe when she's bending forward and backward, maybe it moves. So if her pain turns out not to be responsive to treatment, I'll probably send her for some lumbar x-rays with flexion and extension to see if this moves any more. Usually they do not. Usually these slips are stable slips, and bending forward and backward doesn't change on x-ray, but we'll see. I still don't feel like I have a understanding of why she's having all the pain she's having now. Anyway, we'll see. I'm Dr. Craig Castanet. If I can help you with your neck or back pain, give me a call, 404-558-4015. I'm in Decatur, Georgia, which is near Atlanta. It's a little city adjacent to Atlanta. And If you'd like to learn more, you can go to my website, backstrong.net, and from there to my YouTube channel. Thanks very much. Bye-bye.